was quite an honor. There was 10 hospitals that Ardent has in their system. They have 6 hospitals out in Arizona, New Mexico, Albuquerque, and then they have Hillcrest and OSU, Bailey, and Cushing, and Henrietta. And it's nice to know that 8 of the 10 awards were brought back by Oklahoma Hospital. Not only did we win CEO of the Year, but we also won the Physician Satisfaction Award. And it's a survey that the Ardent does every year to the physicians. And we ranked in the 96th percentile of all hospitals in the country. And the closest Ardent hospital to us was at the 70th percentile. So that tells me that all of us, the employees and everyone, treat our physicians with respect and take care of them. And so we were able to bring that award home. We did miss the Employee Satisfaction Award, just about this much, but it was glad to know that Henrietta, Oklahoma won the Employee Satisfaction Award for the 2nd time in a row. And Bailey Medical Center in Owasso won the Patient Satisfaction Award. And if you have not been to Bailey, you should go to Bailey and walk around, and you'll understand why they won the Patient Satisfaction Award. They have a big fireplace when you walk in the hospital. They have a big spring in the lake that's out in front of it. The patient rooms are about this size, and they all have hardwood floors. You know, it is quite the show place. But we didn't miss it far. We came in 2nd on patient satisfaction. We came in 3rd of the 10 on employee satisfaction. And then the CFO at OSU won the Chief Financial Officer of the Year Award. And Hillcrest, believe it or not, won the highest quality award of any of the hospitals in the Ardent system. So it was a very good leadership conference for us. Next year we just want the other 2 awards to go along with the other 8. And you know CEOs are not real competitive at all. But we have done well. The system has done well. I can tell you, if we continue to grow the way we're growing right now, currently we're averaging, last year we averaged about 43 patients, and we're averaging about 55 patients this year. And a few more years, if we continue to grow, we'll be trying to find some additional space. And it's proud to be part of a group that is progressive as we are here. The one thing about it, they asked me, they said, how many jobs have you ever applied for in your lifetime? And I have never applied for a job in my lifetime, but I have worked for the Masonic Association, which was a not-for-profit. I worked for a political subdivision of the city. I worked for a management company. I worked for a not-for-profit organization and a for-profit organization. And I was only one of about five CEOs there that have ever worked for that many organizations, and I have never left this job here. So I'm going on 35 years. Hope to be able to retire here. And it's also nice that we've got such a great group of employees to back you up. We just set and give the rewards, but as I said again, you all do the work, and we appreciate that. The city, we wouldn't have this hospital if it wasn't for the city. Another thing that they bragged about on us is the first hospital that is a true partnership between a city government or political subdivision, which is the hospital authority, a for-profit group, which is Ardent, and a not-for-profit group, which is the foundation. Well, this hospital is a combination of all 3, and it's kind of unique in the way it is occurred. And as you know, Ardent has given the state of Oklahoma the OSU hospital, which will put them on a sound financial footing. The city of Tulsa is not happy because, as you know, as a political subdivision, you don't pay any kind of taxes. You don't pay sales tax. You don't pay property tax. And if you're sued, the most you can get sued for is $100,000. So by the city or the state taking over that hospital, that means puts about $13 million to their bottom line, which then makes them a hospital that is back to being profitable again. Now the city doesn't like it, the state doesn't like it, but it's good for the state of Oklahoma and the program for the residency. So yeah, people please in. But again, I want to thank you all. I appreciate you all coming out. Appreciate getting this award. It's been a lifetime goal, and you know, hopefully we can expand again before we quit. If you would, I'd just take 2 minutes to tell you where we're headed. Tonight we'll be visiting with the physicians and hopefully finishing up the plans for the specialty clinic, which will be built on the gravel parking lot. If the city chooses to build that and lease it back to us, or lease the property and we will build it. We are probably have a 50-50 chance of landing a kidney dialysis center here, which will be brand new, state-of-the-art, 20-bed kidney dialysis center, which would then, we would have a full-time nephrologist in Cushing, which I'm not sure they even have one of those in Stillwater. I think they come back from Oklahoma City and Tulsa. We are in the process of recruiting a full-time cardiologist. We're in the process of recruiting additional general surgeon, possibly an additional OBGYN to do clinics in the outlying areas. And so we're going to have some space for physicians. And I want to thank the city. I think the city has taken the first step in looking at some additional property so that we can expand. And when I started here, 1974, we were in the old